What do you make of how quickly the line is moving? People are saying they're waiting about half hour to an hour. Is that pretty reasonable based on what you were planning for?
Well, we have a good public health team, and we have good assistance by other city departments, the Milwaukee Police Department, Milwaukee Fire Department, Visiting Nurses Association, to mention. There are many of us here. We've been doing this public health preparedness planning for many months. We're pleased that we can have a throughput in that half-hour span, but we know as demand increases, that could slow down or it could speed up. And we're going to expand our lines to ultimately 24 lines, and hopefully we'll get them through even faster.
Commissioner, how many, and maybe the mayor wants to talk about this as well, how many do you think out there are uninsured or underinsured, and what type of challenges does that pose to you guys as far as demand? Because this is probably the only place they can go.
Well, I can start and I'll let the mayor comment on that. First, this is a free vaccine, and there's no cost to anyone who should come in. While we prefer and we're targeting those who are uninsured or underinsured because they're most likely not to have a medical home or a primary care provider, if individuals who have commercial insurance and they meet one of the target areas, we're not going to turn anyone away today. Our focus in public health has always been targeting the underinsured and the uninsured, but today the vaccine is the best protection for those who meet the category. This is a free vaccine, so the fact that individuals have commercial insurance, while that is good, it is not a rate-limiting step in one getting the vaccine or not getting the vaccine today.
What kind of feedback are you
being turned away who does not meet that target age?
If you're in one of the high-risk categories where you can't utilize the intranasal dosage, you will be told that you will have to return when we have more injectables. So we are telling some individuals that they need to come back. We are going to administer approximately 300 injectable doses, but the line has already queued. We have 700 people come through the door, so it's likely that individuals showing up now wouldn't get that injectable. So we have turned some folks away, but
what kind of feedback are you getting from people? Do they understand
again, if I can, and supplement what Commissioner Baker said, our whole intent is to make this accessible to the people who live in this community, regardless of income, regardless of race, and we really feel that it's important for us that the public knows that we are not seeking any money for this. This is something that is being done for public health purposes. Those who don't have insurance, we ask them to come. If you do not have an insurer, if you do not have a physician, please come here. That's why we're here, to make sure that you don't get sick. So that's the purpose. You can tell from the location here, it's centrally located, it's on bus lines. We want people to take advantage of this. The whole purpose is to prevent disease, and we're hoping that people will heed that call.
Mayor, have you walked through the lines, and what do you kind of make of how the clinic is running today?
I think it's running smoothly. I think we may see another push after school lets out. That's one of the concerns I have. A lot of kids are in school today, and I'm sure we'll see mothers and caregivers and fathers bringing their kids after school. So we just want to make sure that as we expand the lines that we can keep this moving quickly. But people have been patient, and that's very, very good.
So did you have any expectations? I mean, did you expect people to be wrapped around the building 3 times, or?
Well, we discussed that we wanted to just make sure that this was running smoothly, and I didn't want a situation where people were standing in line for 6 hours and then being told that they were going to be sent home. So we're keeping up with it. I think we're doing a good job right now keeping up with it. So my fears and concerns, I think, which we all shared, that we'd have 40,000 people here, those fears and concerns have not come to fruition. So it is running smoothly, and people should know that if they're watching. It's running smoothly right now. Again, we might have a press later in the day, but as of right now, it's a good organized method of distribution.
I'll end finally by saying that throughout the day we will monitor our throughput and our demand, and we will decide later this afternoon whether or not we can stand up additional clinics tomorrow if vaccine is available. It's our hope that we have the capacity to dispense most of that vaccine today, and again, the team on the ground is doing a wonderful job, and we are hopeful that we will have additional vaccine in the future. So.
Do you expect to hold another briefing like this once some of those decisions have been made?
Well, I will certainly be in a position to alert all of our media outlets in real time if indeed we have enough vaccine to stand up additional clinics. Based on our current volume, and as Mayor Barrett said, there could be a push after 4 when schools are out. It is unlikely, but we'll have to wait and see. So we will report to our media outlets as soon as we know. Thank you.
Thank you all very much.